Thank you po, Doc.
Thank you, Doc.
Thank you
Thank
po,
you, Doc.
Doc.
Malusog na araw sa ating mga viewer at sa'yo, partner.
Malusog na araw, partner. So ano bang topic natin for this episode?
Ang topic natin ngayon ay ang kilalang-kilala na diabetes mellitus o diabetes. Alam mo ba na milyong-milyong Pilipino ang apektado sa sakit na to? Kaya mahalagang aware tayo dito.
Agree, partner. Upang gabayan tayo sa usapang medikal, kasama natin ngayon ang dalawa sa pinakasikat na integrative medical specialist sa bansa, sina Doc Frankie at Doc Robbie.
Magandang araw, like at Nico at sa ating mga viewers. Shoutout po sa mama ko. Ma, nasa TV na ako.
Salamat sa pag-imbita sa amin, Laika at Nico.
Para mas maintindihan natin ang diabetes, tara at panoorin natin ang naging experience ng isang pasyente na may diabetes ketoacidosis na itago natin sa pangalang Franz Candido.
Ako'y tahimik lang sa umpisa, kahit di mo ko pilitin.
Tigilan mo nga yung kakasigarilyo mo. Hoy, may injection ka pa, hindi mo pa ubos yun. Ang tagal na nun ah.
Meron ka bang lemon? Gusto ko ng tequila, pagkatapos ko mag-shot.
Katapos pag-aralan ng lab results ay nagreseta ng gamot ang doktor ni Franz. Nangako ito na makakauwi na si Franz kapag bumalik na sa normal ang ECG at lab results nito.
Gusto ko ng tequila.
Partner, parang kamukha mo yung asawa ni Franz. Pero teka, absorb natin to, no? Si patient ay diabetic, tapos ashtray ba yun? So, smoker din siya?
Yes, he has been a heavy smoker and he has diabetes mellitus type 2. He did not inject insulin for almost 2 days, so he had diabetic ketoacidosis.
Sa mga kaso katulad ng ganito, Doc, anong karaniwang mga test ba ang kailangan gawin pagdating sa ospital?
Upon arrival, he is clutching his chest. So after taking his vital stats, I think it's necessary to study his ECG. Then it is common for diabetics to have ketogenesis, which can be checked via urine dipstick and using glucometer, which we will know if his blood glucose concentration is elevated.
Apart from those tests, normally I often require an arterial blood gas analysis apart from different biochemical tests aimed to check the electrolytes of the patient.
So deeper into the case, no? Ano ba yung common sign na mataas yung blood glucose ng pasyente?
Ay, partner, may tiyahin kasi akong may diabetes, tas ang na-observe ko sa kanya, lagi siyang uhaw, tapos pabalik-balik siya sa banyo, tapos parang lagi siyang gutom. Ganun po talaga yun, Doc? Pwede mo bang i-explain in layman's term po bakit ganun?
Okay. Because the blood glucose is increased, more glucose will go to the nephron. Then eventually, it will exceed the renal threshold or the glucose reabsorption capacity of the nephron. Glucose will now pass to the distal parts of the nephron. Then water follows from the interstitium. This is called osmotic diuresis. So there will be an excessive water loss in the urine, leading to dehydration.
Get. So dahil dehydrated si patient, dahil marami siyang naiihi, andun yung feeling na lagi siyang nauuhaw.
Very bright ka dyan, partner ah. Doc, yung palaging feeling niya gutom siya.
To explain that, we need to know what insulin is for. So, to quote one of my professors, she said that insulin hides the glucose present in the blood in other organs so that they can be utilized as an energy source or as an energy reserve. Since he did not inject insulin, glucose from blood cannot enter the organs, so there would be a lack of energy source which triggers yung hunger.
And nabanggit din yung diabetic ketoacidosis at ketogenesis kanina, no, partner? Paano nagkaroon nun si Franz? Normal ba yun sa mga diabetic?
We already know that the patient is diabetic. The tendency of the body is to find another energy source. Lipolysis or lipid oxidation can occur, causing free fatty acid accumulation, leading now to ketogenesis. When ketones accumulate, it will cause ketoacidosis where the blood will become acidic.
Kaya pala nag-a-alarm talaga si tita para di niya makalimutan yung insulin injection niya bago kumain.
You're right there, Laika. No? As far as I know, the patient was immediately given intravenous insulin and a buffer such as sodium bicarbonate as treatment.
I agree, Doc Frankie. Then to replenish lost fluid, it is also imperative to administer normal saline fluid replacement.
May iba naman po tayo, Doc. Upon presentation, anong karaniwang lagay ng mga diabetic ketoacidosis or DKA? Kagaya na lang kay Franz.
Commonly, those with ketoacidosis present with shortness of breath, hypotension, and tachycardia. Diba si Doc Roby mentioned earlier that si osmotic diuresis, no? So this leads to the contraction of blood volume. So the blood pressure will decrease. As a compensatory mechanism, the heart would speed up pumping, so the patient will become tachycardic.
Doc Robbie, nabanggit mo kanina yung arterial blood gas po ba yun? Pwede mo po bang pa-expound?
Okay, sure. The ABG is done to find out if the patient has an acid-base disorder. In metabolic acidosis specifically, ketoacidosis, what you expect here is decreased pH, meaning his blood is acidic, and the major acid-base disturbance is decreased bicarbonate. It decreases because it binds with protons that came from the dissociation of ketones.
Ay, naka-flash pala ang mga results. Bakit pala sobrang layo ng PCO2 sa normal levels?
The level of partial pressure of carbon dioxide is looked at to know if the patient is compensating. So, since it is low, there is partial respiratory compensation via deep and fast breathing.
At bukod sa mga nabanggit na sintomas, ano pa nga bang manifestations ng DKA, partner?
Ay, buti na itanong mo yan, partner. Based sa research, ang pagsusuka, pagmamanhid ng kamay at paa, hypercholesteremia, drowsiness at disorientation ay kabilang sa nararanasan ng pasyente.
So talaga nga napakarami ng komplikasyon na naidudulot ng sakit na to, no? Doc Frankie, bakit nga po ba naranasan ng pasyente yung epigastric pain kasabay ng pagsusuka?
Kasi ketone body accumulation, ini-impair na enteric nervous system function natin, causing delayed na gastric emptying. So it leads to stomach distension and irritation ng gastric lining, which eventually causes yung activation ng vomiting center in the medulla oblongata na nagkakos ng vomiting.
Doc Robbie, Doc Frankie, isa sa manifestation na nararasan ng pasyente ay yung pamanhid ng kanyang kamay at paa. Maaari niyo po bang i-explain ano yung sanhi nito?
Sure thing. So, yung loss of sensation in this manner is medically termed as stocking glove neuropathy. This occurs because the damage in peripheral nerves as a result of the activation of the polyol pathway. This induces the accumulation of sorbitol via the enzyme aldose reductase, resulting to a reduction in nerve myoinositol content and sodium-potassium ATPase activity, leading to reduced nerve conduction velocity.
I agree with Doc Robbie, no? So another possible mechanism is that the increase in blood glucose causes a decrease naman in blood vessel elasticity. So yung narrowed na blood vessels make it more difficult to supply blood to the peripheral limbs. The overall effect of this is neurovascular impairment and peripheral nerve damage.
Doc Frankie, nabanggit rin kanina ni partner yung hypercholesterolemia po ba? Ano nga po ba ito at ano po yung naging sanhi?
So hypercholesterolemia is high cholesterol. So specifically yung LDL natin o yung low density lipoprotein. Another effect of low insulin levels is impaired insulin action dun sa liver natin coupled with high or increased production ng VLDLs natin and LDLs, which are yung tinatawag natin na bad cholesterol, which may lead to increased na cholesterol levels.
Doc Robbie, nabanggit po na maaaring maranasan ng patient yung matinding drowsiness or matinding antok. Bakit po ito nangyayari?
Drowsiness is explained by inefficient glucose utilization. The cells cannot utilize glucose in order to carry on the production of ATP, so the body resorts to alternative glucose sources in a process known as gluconeogenesis. With this, the rate of ADP phosphorylation decreases as well as the rate of ATP synthesis, leading to diabetic fatigue syndrome or yung drowsiness.
Doc Frankie, kasama rin sa sintomas ng pasyente yung disorientation po, no? Paano po ito may relate sa kanyang karamdaman po?
Well, it was mentioned that osmotic diuresis causes the decrease in blood volume. So, abnormally high amounts of glucose coupled with excessive water loss increases yung osmolarity ng blood. In turn, yung cerebral dehydration will occur, leading to disorientation experienced by the patient.
Nakakatakot naman po pala yung secondary complications ng diabetes.
Tama po. That's why it is ideal to practice a healthy lifestyle in order to lessen the risk of developing these complications. It's also imperative that consistent and proper maintenance of prescribed medications is observed in order to impede disease progression and also improve the patient's quality of life.
May I ask po, Doc, bakit pati po yung ECG hinintay bago maging normal before siya ma-discharge? Diabetes naman po yung problem.
Kasi one of the tests was done to check the patient's electrolytes, and it was found out that he is experiencing hyperkalemia. So this results in increased excitability and conduction velocity of the heart muscles, which eventually causes deviations dun sa normal ECG readings. And yung ECG changes in electrolyte imbalances and yung DKA are transient. Thus, it can be resolved after the correction of acid-base disorder.
Wow! Napaka-in-depth ng discussion natin for today's episode.
I agree, partner. Pero ang balita ko, hindi pa din natapos ang kalbaryo ni Franz. So don't go anywhere and we'll be right back after a quick commercial break.
Hala pa! Ano nangyayari sa'yo? Uy! Ang lamig ng kamay mo!
Huwag ka magulo. Nahihilo ko.
Hala, tara pa, check up na tayo. Kasama ko.
Miss, ibas mo na kayo,
Hindi,
miss.
ano mangyayari
Ibas
sa
mo na
kanya?
kayo, miss.
Pa!
Nurse, paki-prepare na lang ng infusion insulin, IV calcium, gluconate, sodium bicarbonate, pati na rin ng calcium vesonate.
Opo, yes po, Doc.
Naku, mukhang mas lumala pang sakit ni Franz. After 2 months, nakaranas na rin siya ng hirap sa paghinga at mas lumala pa yung panghihina ng kanyang nararamdaman.
Tama, kaya huwag nating patagalin pa at alam kong gustong-gusto ng malaman ng viewers natin ang explanation na nangyari kay Franz. Mula sa diabetes ay sobrang dami ng kakaibang symptoms that manifested. Mga Dok, ano po bang masasabi nyo sa case ng ating pasyente?
It can be seen that Franz developed acute respiratory failure type 2 because of the several electrolytes, metabolic, and acid-base derangements brought upon by diabetic ketoacidosis.
That's right, Doc Frankie. Consequently, the buildup of acid in the respiratory system being unable to adequately remove carbon dioxide from the body can lead to hypercapnia and respiratory acidosis.
Pero mga Dok, bakit kaya hindi kinaya ng lungs ni Franz na i-remove yung excess carbon dioxide sa kanyang katawan?
Because the presence of metabolic acidosis will normally generate a respiratory response. So yung reduction of serum bicarbonate and pH will result in hyperventilation and reduction ng carbon dioxide, partially preventing further fall dun sa pH and bicarbonate. However, meron na kasing limit dun sa ability ng lung to compensate for metabolic acidosis. Initially, yung patients will develop tachypnea, but with the progression of acidosis, the respiratory pattern evolves to hyperpnea, which is increased tidal volume, and ultimately, patients will develop a deep and fast pattern of breathing na tinatawag nating cosmos respiration.
To further highlight the initial ABG of the patient, it can be interpreted as respiratory acidosis without renal compensation. So the kidneys might have been affected already. Also, it is without renal compensation because the bicarbonate level of the patient remains low.
Wow, ganun pala yun, no? Grabe pala talaga ang diabetes. Kaya niya maapektuhan ng different parts ng katawan natin gaya ng lungs at kidneys, no? Kaya mga Doc, curious pa po ako, ano pang mga parts ng body natin ang affected ng diabetes?
Good question, Laika. If you would notice, the patient experience yung severe generalized muscle weakness, hypotonia, grade 1/5 muscular weakness, and yung absence of reflex. We can relate these symptoms to diabetic neuropathy. Actually, there is a term in medicine called neuropathy of disease. Ito yung tinatawag natin na neuropathy, nephropathy, and retinopathy.
And also yung stocking glove neuropathy was already discussed. And another possible factor is the non-enzymatic reaction of excess glucose with proteins, nucleotides, and lipids, which results in advanced glycation end products or AGE, which disrupts yung neuronal integrity and repair mechanisms through interference with nerve cell metabolism and axonal transport. Lastly, yung oxidative stress causes an increase in the production of free radicals that may result in direct damage to blood vessels, leading to nerve ischemia and facilitation of AGE reactions.
In general, hyperglycemia can damage the nerves in the legs and feet, resulting in muscle weakness, hypotonia, and slow or absent reflexes. Additionally, I would like to mention the definition of grade 1/5 muscle weakness, since some of our viewers may still be unfamiliar with the term. No? So this means that the muscle contraction is noted, pero walang movement na nangyayari. So here, the muscle is not strong enough to lift the particular body part.
Ayan may bagong terms na naman tayong natututunan. In relation with this, mga dok, merong isang term dito na hindi ako familiar. Ano bang ibig sabihin ng cyanosis?
Actually, Nico, cyanosis is the bluish discoloration of the skin resulting from poor circulation or inadequate oxygenation of the blood. In regard with the patient, this is caused by DKA along with acute respiratory failure. This results in a decrease in cardiac output and an increase in total peripheral resistance. The body will compensate by decreasing the blood flow to non-vital organs like the skin, leading to peripheral tissue hypoxia, which manifests as cyanosis and cold extremities.
Ganun pala yung meaning ng cyanosis at nakakamangha din no, na connected pa rin pala to sa DKA at respiratory failure.
Kaya nga partner, ngayon naman dumako tayo sa laboratory findings. Karamihan sa mga ito ay may abnormality na simula pa nung first admission. Pero may mga bago rin naman, kagaya ng phosphate, na nagkaroon ng slight increase. Mga dok, ano kaya ang dahilanan bakit merong hyperphosphatemia?
Okay, so during diabetes, there is an increase in the breakdown of muscle protein. So this will cause the intracellular anion to be released into the extracellular fluid, causing an elevation in plasma level.
That's right, Doc Frankie. And another factor is diabetic nephropathy, which was mentioned earlier. Hyperglycemia can cause hyperfiltration and renal injury. In patients with renal disease, the kidneys cannot excrete phosphate, and because of continued phosphate absorption by the intestinal tract, it accumulates in the body, and the plasma phosphate level rises, resulting in hyperphosphatemia.
Another thing to mention with the lab findings is the normal concentration of troponin 1. This is a highly specific and sensitive to cardiac myocyte, and therefore a normal level indicates na wala tayong cardiac damage.
Kakaiba pala talaga ang diabetes mellitus. Nakakatakot na nakakamangha.
So, true partner. Pero syempre, hindi tayo papadaig sa diabetes. So, over the years, multiple treatments had been invented. Kasama na dyan mga ginamit kay Mr. Candido. Mga doc, could you explain naman po sa amin what are the uses of these medications?
Oo naman, Laika. So, all the medications used for the second admission of the patient are to help lower down yung hyperkalemia. As explained during the first visit ni patient, since there is an increase in hydrogen, the body tries to compensate by exchanging the intracellular potassium for extracellular hydrogen, thereby increasing serum potassium levels.
To add, yung hyperkalemia, it causes the abnormal ECG of Franz, and intravenous calcium gluconate antagonizes yung potassium-induced decrease in membrane excitability ng cardiomyocytes, preventing yung development ng potentially lethal arrhythmias and stabilizing yung cardiac response.
On the other hand, yung insulin infusion and intravenous sodium bicarbonate both act in the skeletal muscle and promotes an increase in the abundance and activity of the sodium-potassium ATPase, thus causing potassium to shift into the cells. While yung nasogastric administration of calcium resonate is a polystyrene cation exchange resin that acts to remove excess potassium from the body by exchanging it for calcium. Lastly, yung hemodialysis helps control blood pressure and balance important minerals such as potassium sa blood.
After treatment po mga doc, may kita natin na may changes sa lab results ni Mr. Candido. Isa na rin po syempre dito yung pagbaba ng kanyang potassium level.
That's right, Laika. And also worth mentioning that the repeat ECG of Franz shows no abnormalities, since hyperkalemia is the one that causes it by increasing yung excitability and conduction velocity ng ventricular cardiomyocytes, and early repolarization occurs synchronously.
I would also like to point out the improvement sa ABG results of our patient, since the performed treatment somewhat helped in balancing the electrolytes, metabolic, and acid-base derangement brought by DKA.
Naku, mabuti naman at kahit papano naging maayos-ayos na yung kalagayan ni Franz. Sana magtuloy-tuloy na.
Teka, ano ba ito? Ito ba yung insulin shot ko? Mamaya na yan. Ni Dr.
Ni Dr. House, napagalitan siya ni Dr. House. Hala, paano nangyari sa'yo? Uy,
Sumisikip yung dibdib ko, May.
tara na, dali na kita sa ospital.
Wag na, ma. Sayang sa oras, tapos mawawala din to mamaya.
Hindi, huwag ka nang maarte. Nurse!
Ano yung stretcher? Bakit? Ano nangyari?
And I truly believe that's just how I feel. That I'm worth.
Bakit? Ano nangyari?
Ano ba yung asawa ko? Sumisikip ng todo yung dibdib niya.
Grabe, after 5 months lang, pumalik na ulit si Franz sa hospital, no?
Oo nga, nakakaloka. Mukhang mas lalong lumala siyang sakit niya ngayon. Nakakaranas na siya ng severe chest pain, restlessness at dehydration.
Isama mo pa, partner, yung pagiging dyspneic at takipnik niya. Nagkaroon din siya ng intractable vomiting at confusion kahit na-admit na siya sa hospital.
Tama ka dyan, partner. Grabe talaga nadudulot ng diabetes pag nawawalan ka ng insulin. Huwag na nating patagalin pa at alamin na natin ang dahilan ng mga sintomas na ito. Mga dok, ano po bang masasabi niyo sa third visit ng ating pasyente?
Nakikita ngayon sa screen yung mga laboratory results ni Franz sa kanyang third visit. No? So, we can notice that his BP, heart, and respiratory rate is elevated upon admission. One big influence to this is yung heavy ketonuria brought by not taking insulin. So, along with this, he is also experiencing diabetic nephropathy.
Dok, may I ask lang, last time po, tachycardic at may breathing issues na siya. Why now nagkaroon siya ng dehydration, severe chest pain, at saka intractable vomiting?
That's a good observation, no? So, explain natin isa-isa yung mga symptoms na yan. So, for dehydration, it can be attributed to the hyperglycemia or the patient, along with the increased BUN due to the decreasing kidney function as well as DKA, no? So, due to these factors, dehydration and changes dun sa electrolyte balance niya, it will decrease yung extracellular volume which would now activate si RAAS. And itong dehydration na to can also lead to state of confusion and unresponsiveness due to the increase in hyperosmolarity ng blood.
For the severe chest pain naman, we can observe that the CKMB and troponin levels. Usually, if somebody experienced myocardial infarction, elevated both levels of CKMB and troponin. However, in our case, only the CKMB ang elevated. So, bakit ito nangyayari? Possible explanation to this is that our patient did not experience MI. Let us recall that our patient experienced DKA resulting in electrolyte imbalance. He is also experiencing hypercholesterolemia, which can increase the case of atherosclerosis. With these factors, we can say that our patient experienced unstable angina only due to the lack of oxygen reaching the chest area, which could develop into MI.
Doc Robbie, is that the possible reason why the chest radiograph showed a heart without cardiomegaly?
Yes, you're right. As a compensatory mechanism for the ischemia of the heart, it will increase in size to sufficiently supply the body with blood. However, it is not seen, and along with low troponin, we can say that ischemia in the heart is not yet severe.
We can also notice yung elevated CK levels niya and hyperphosphatemia, which can be attributed to the further muscle breakdown as gluconeogenesis occur to supply the body with glucose. For the vomiting, we can attribute it to gastroparesis of the patient. Since he is experiencing DKA over time, this can result to impairment of the vagus nerve, leading to autonomic neuropathy and eventual enteric nervous system. The gastroparesis can be exhibited by the symptom of soft and tender abdomen in our patient. So yung distension and irritation ng stomach can result to feeling ng fullness and nausea.
Lagi talagang damay-damay iba't ibang system sa body tuwing nagkakasakit, no, Miko?
That's true, Laika. Kitang-kita sa ating patient tsaka yung effect nito. Doc, can you explain what medications were given and why?
These 3 medications were given to treat the severe chest pain experienced by the patient. It is used as a precaution to the possibility of myocardial infarctions. Specifically, aspirin is used as a blood thinner, yung glyceryl dinitrate tsaka yung isosorbide dinitrate for relaxation of vascular smooth muscle and dilatation of peripheral arteries and veins naman.
However, it was noted that the chest pain still persisted despite the initial treatment. At this time, the patient was given morphine for the relief of pain, midazolam to calm the patient, and heparin to continue the blood thinning and prevent the possibility of MI.
So after this, the patient became stable for proper interview and he wasn't taking insulin properly po.
That's right.
They then proceeded with insulin injection and rehydration therapy. What may be the purpose of this, Doc?
The rehydration therapy was used to correct the electrolyte imbalances of our patient brought about by the DKA, and this is to prevent any further complication.
He was given insulin so he can utilize the glucose properly and reverse the occurrence of ketoacidosis. So we can see that before discharge, the patient was stabilized due to this treatment, since the low of insulin and the electrolyte imbalance was the actual cause of the patient's complaint.
That's very interesting, mga Doc. I hope our viewers listen carefully to what you guys have explained.
Napaka-fruitful ng ating discussion today. So stay tuned guys kasi papalapit na tayo sa end ng ating kwento. Ano kayang kahinatnan ni Franz sa kanyang DM?
Napagpasyahan na ni Franz na bumisita sa isang endocrinologist upang masubaybayan ang kanyang diabetes. Ito nalaman ni Franz sa kanyang kalusugan matapos ang nakaraang insidente. Binigyan din siya ng iba't ibang payo upang makatulong sa pag-manage ng kanyang sakit. Pagkatapos ng 4 na araw, bumalik ulit si Franz sa endocrinologist ayon sa payo nito. Muli ulit inassess ang kanyang laboratory results at pinagsabihan siya na palagi mag-insulin para hindi lumala ang diabetes niya.
At this time, mabuti naman at bumisita na si Franz sa isang endocrinologist.
Importante talagang maging proactive tayo sa mga condition natin para hindi ito lumala. At in fairness, partner, kamukha mo yung doktor doon.
This time naman, yung kanyang complaint ay muscle weakness. Kasama naman niya yung iba pa niyang laboratory results. Doc, ano kaya yung possible reasons ng mga to?
Based on the lab results, we can notice hypertension, proteinuria, and non-specific ST and T-wave changes. Let's try to explain each of it. No?
So for the non-specific ST and T-wave changes, this is attributed to electrolyte imbalance brought by the DKA ulit. Based sa arterial blood gas o ABG ng patient, meron siyang metabolic acidosis with compensation. So this compensation is again by cosmal respiration, which decreases yung CO2 ni patient. So for proteinuria, it is still associated with DKA, which increases yung oxidative stress and cytokines release. This can lead to kidney disease, which affects the glomerular filtration barrier or yung GFR natin, hence inefficiently filtering si blood. This will be the cause of protein leakage in the urine.
Furthermore, our kidney converts vitamin D into its active form to absorb calcium. If the kidney is damaged, less calcium will be reabsorbed, which will in turn increase the parathyroid hormone levels to acquire calcium from our bone.
Ganun pala yung doc, no? Ang daming naapektuhan kapag nasira yung kidneys.
That's true, kaya dapat natin pahalagaan ang ating mga kidneys kahit dalawa sila. And kung babalikan natin sa second admission na yung initial ABG ni Franz was interpreted as wala ng renal compensation. So parang doon pa lang ay makikita na natin yung effect ng diabetes sa kidneys.
Additional effect ng kidney disease natin dun kay patient is yung decreased renin at aldosterone, leading dun sa decreased sodium reabsorption and increased potassium excretion na nag-result sa hyperkalemia.
For yung hypertension naman, we have discussed na DKA can lead to dehydration and decrease in extracellular volume at renal blood flow, which can activate yung RAAS and the sympathetic nervous system. It can lead to increased heart rate, vasoconstriction, and sodium and water retention. This results in increased blood pressure despite the decreased aldosterone levels.
Thank you po, docs, for that wonderful explanation. So let's finish this up and discuss further what happened after 4 days na po.
Okay, so after 4 days, bumalik si patient and it was found that the lab results went down. It means that the patient abide with the doctor's prescription.
Although yung ibang lab result is mataas pa rin like BUN and creatine kinase, it is now lower compared to before.
Mahalaga talaga na sundin natin yung payo ng doktor if gusto nating mapaganda yung ating kalusugan, no?
As the last part of our show, kindly explain to us po again the uses of the medications prescribed by the endocrinologist po.
Okay, so first it was advised was to have a low potassium diet, loop diuretics, and pseudocortisone. So yung low potassium diet kasi was advised to decrease the potassium levels of the patient so muscle weakness can be avoided.
The loop diuretics was given to help the patient treat hypertension as he is already experiencing kidney disease. Lastly, fludrocortisone, a corticosteroid, was given to help control the amount of sodium and fluids in your body since kidney disease affects the activation of the RAAS system.
After 4 days, yung prescribed action was to limit salt intake in the diet to control the hypertension and to take insulin religiously since it is highly needed by his body to prevent from further complications.
Ramipil was also given to inhibit angiotensin-converting enzyme and decreases angiotensin 2 formation. Irbesartan blocks the vasoconstrictor and aldosterone-secreting effects of angiotensin 2 by selectively binding to the angiotensin 1, angiotensin 2 receptor. Both of these medications were given to treat the hypertension of the patient.
Ayan, so that is a wrap for us everyone and I hope na maraming natutunan ng ating viewers from our case for today.
Napaka-common ng diabetes mellitus at alam kong maraming natutunan sa topic natin for today.
Thank you to our docs, Doc Frankie and Doc Robbie po for giving us a clear and concise explanation of this case. Napakadaling intindihin po ng explanation niyo.
Thank you po.
Thank you.
And with that, thank you for our viewers for watching our show. Please hit the like button and subscribe for more episodes like this. Thank you, Doc!
Thank you po, Doc.
Thank you, Doc.
Thank you po, Doc.